Hello friends, good morning. My name is Dr. Shmeet. I'm a consultant psychiatrist at ANR Hospital, Jalandhar. Today I'll be talking to you regarding depression in adults and depression in children. Depression is an escalating problem these days. We all hear about people going into depression. A number of suicides have increased in the last couple of years. So when does it actually start? Does it happen in childhood? Does it happen in adolescence? Does it happen in adulthood? So there are a number of factors which need to be told regarding this. My idea of uploading this video today is to basically psychoeducate the population regarding the increased incidence of depression in today's world. When I talk of depression, what do I really mean? Does it simply mean that I'm having a sad mood, or does it mean something more than that? See, we all feel sad when we lose something in life, when we lose a pet, when we lose a partner, when we lose a loved one, or when we lose our job, when we lose our friends. We all tend to feel sad. But then, does that quantify to be depression? I would say no, because when you're able to come out of your problems and move ahead in life, so that was just a fluctuation in your mood. But when I talk of depression, I mean pervasive sadness of mood, and that is associated with loss of interest in pleasurable activities. You have lack of energy, you don't feel like talking to anybody, you might get more irritable, and then your appetite might increase or decrease. In children, when we see depression, a child is not able to communicate what he is suffering from. So basically children would present with behavioral abnormalities, school refusal, decline in academic performance, and there are a number of factors which lead to depression, especially in children. So when we talk about depression in children, what are the risk factors that we have to look into? Is there a biological history? Is there a family history of depression that is present? And how is the school environment? Is the child bullied in school? Is he having a lot of academic pressure from the teachers or parents? Or is it something that he is having a lot of peer pressure during which he is not able to cope up with the environment in the school and the house? So is the depression related to that? So a number of things have to be taken into account. And as the child grows he has to undergo a lot of hormonal changes which could also be contributing to it. There is a body which is transforming. So many things can lead to depression in children. So this was regarding the risk factors, and what as a clinician I would suggest the parents to do is to spend more time with the child, to spend more quality time with the child, spend time with the teachers to see if there is any change in behavior of the child. And when it is about seeking help from a professional, it has to be taken well in time. You cannot really delay that help, because most of the time we feel that it is just a phase which will pass on. But sometimes the child may not communicate it to you, your partner may not communicate it to you, so you have to seek professional help. When I'm talking about professional help, there are basically two things that we specialize in. One is the psychological intervention, the other is the pharmacological intervention. The first trial of any treatment for depression is psychological intervention until and unless the depression is of very severe grade or is associated with psychotic symptoms, or it is a suicidal depression. The trials of psychotherapy are given according to the patient needs. It could be cognitive behavior therapy, it could be interpersonal therapy, it could be supportive therapy. When it comes to pharmacological management, a lot of people have issues whether the medications are going to be addictive, whether they have to be taken for the rest of their lives. But these are all myths. See, basically when we are talking about depression, there are certain neurochemicals in our brain which have gone dysfunctional. So the idea of pharmacological treatment is to get that neurochemical balance right. So at times, sometimes when the patients deny pharmacological management, we actually see that the depression takes a lot of time to remit. Since depression is increasing in incidence, my suggestion to you is please take care of your mental health and don't feel shy to seek professional help anytime when you need it. Thank you.